This is Dr. Lewicki, and this is the urinary tract infection voiceover PowerPoint. Urinary tract infections are the most common infection and second most common bacterial disease in women. Common causes, the most common pathogen is E. coli. Second is Candida albicans. Uh, may be caused by having an indwelling catheter or asymptomatic colonization. Fungal and parasitic UTIs are uncommon. They're classified as upper or lower. Usually what we see are the lower uh, UTIs, which are usually the bladder, and they're uncomplicated. Upper is pyelonephritis when the renal parenchyma, and remember parenchyma is the tissue, so the kidney tissue itself, the pelvis and the ureters are infected. So that's pyelonephritis. Lower again is bladder and urethra. You can get systemic spread and it can develop, the patient can develop urosepsis, which is a life-threatening problem. Complicated occur with structural or functional problems within the sites of infection. This is from figure 45.1, and we've got lower and then the upper urinary tract, which is the pyelonephritis. Pathophysiology, generally speaking, the urinary tract above the urethra is sterile. The defense mechanisms that our body has include complete emptying of the bladder with voiding, the ureterovesical junction, the ureteral peristalsis that propels urine towards the bladder. The urine is typically acidic, so it has a pH of about 6 or below. There's a high amount of urea in the urine, and the glycoproteins which inhibit bacterial growth. Risk factors for UTI include obstruction, retention of urine, renal impairment, foreign bodies. Foreign bodies would be catheters, but also kidney stones or something like that. Anatomical factors, compromised immune response, functional disorders, and other factors. Organisms from the perineum ascend through the urethra. The GI tract is gram-negative bacilli. Contributing factors include urological instrumentation and sexual intercourse. Hematogenous transmission. UTIs are the most common healthcare-associated infection. And one of the ones we look at is catheter-associated urinary tract infections. Those most often cause E. coli or are caused by E. coli or Pseudomonas. And if a person develops a UTI while in the hospital, that increases their length of stay, the cost, and their morbidity and mortality are all increased. Clinical manifestations, and most of us have probably had lower UTI, and so there's hesitancy, intermittent dribbling, there's retention, there's incomplete emptying, there's pain, there's burning, there's a little bit of urine coming out. Storage symptoms include urinary frequency, urgency, incontinence, nocturia, and nocturnal enuresis. So nocturia is having to void at night. Nocturnal enuresis is bedwetting at night. They could have hematuria and or cloudy appearance, and many problems produced with lower UTIs can be confused with an upper UTI. Upper UTI is flank pain, chills, and fever, and they may also have fatigue, anorexia, or be asymptomatic. Now, the thing is that upper UTIs, and we don't really talk about kidney stones, but kidney stones, the presenting symptoms are similar. Older adults may not have the classic symptoms, and they may have cognitive impairments, abdominal discomfort, or generalized deterioration. And they can also have asymptomatic bacteriuria, which is a colonization of bacteria in the bladder. Diagnostics, initially they would do the dipstick of the urine in the doctor's office for nitrates, white cells, and leukocyte esterase. They'll send off for a urinalysis and a urine culture and sensitivity. They're going to be looking at history for recurrent UTIs, complicated UTIs, CAUTIs, or healthcare associated infections, and a UTI that's unresponsive to typical therapy. And they may need an ultrasound or CT scan depending on the interprofessional care, diagnostics, we've talked about already, management, patient teaching, adequate fluids, drug therapy, and we usually will push, or they will get azo over the counter, and they may need antibiotics. Recurrent UTI, we're going to do the same, but then we're going to want to make sure that the urine CNS, we're giving the right antibiotic for, and then they may need antibiotic for a longer period of time, up to 2 weeks. Uncomplicated UTIs, antibiotics that they use might be Septra, cephalexin, fosfomycin, maybe ampicillin, amoxicillin, or cephalosporin. Complicated, they may need fluoroquinolones. Fungal, they may need fluconazole. And the azo dye, the phenazopyridine, is an analgesic. It'll help to reduce those spasms, that urinary spasms that they get. And remember that when they take azo, it turns their urine bright orange right away, and they need to know that because it will stain their contacts, their underwear, their tears. Subjective data includes what the patient is reporting to you, plus their perception of their functional health patterns. Their nutrition, you want to talk about what their elimination is like, what it typically is like, cognitive and sexuality, especially if it's a reproductive, if they're in a reproductive age. Objective data is general, you can see their discomfort, what their urine looks like, and any diagnostic findings. And nursing diagnoses include impaired urinary system function, acute pain, lack of knowledge, and the goals are to get rid of the symptoms and to not have it get worse by going into the upper urinary tract. We also need to teach them proper hygiene and outpatient wise, which most of these patients will be. We need to make sure they take their antibiotic as ordered, empty the bladder regularly and completely, and before and after intercourse. Evacuate their bowel regularly, wipe from front to back, adequate fluid intake, and if they have a diaphragm, they need to stop using it temporarily. If they have a catheter, and we talk about this in complex sim, avoid unnecessary catheterizations, early removal of indwelling catheters, use aseptic technique on insertion, good hand hygiene, wear gloves for catheter care. And there's evidence-based clinical tool from the American Nurses Association. Make sure that they're getting adequate fluid. It helps dilute the urine and reduces irritation. Avoid irritating fluids and foods. Heating pads to suprapubic or lower back. Warm showers and bath, and those are for comfort. Teach them about their medications and what to look for when they're improving or, more importantly, not improving. That's the end of this PowerPoint. Thank you.